All right, so the last skill we have is exercise prescription for lumbopelvic dysfunction and pre/postnatal status, and just monitoring the cardiovascular response during pregnancy. So basically, with evidence-based practice, the biggest thing we found is that exercise is essential across the boards, whether it's pre, during, or post-pregnancy. So obviously, just like we say with anything else in PT, whatever shape you are before pregnancy, the greater shape that you're in before pregnancy, the better shape you're going to be post-pregnancy. So basically, recommendations have changed over time to state that if you haven't been part of a exercise program before you became pregnant, it's okay to start now. However, the biggest thing is that you're constantly checking in with the proper medical professional. So you want to make sure that it's safe for you to start an exercise program and that you're going at a slow and steady pace that's necessary and essential for maintaining a safe pregnancy. So first thing is, say you have a pregnant individual come in a clinic, you constantly want to be monitoring blood pressure throughout the entire session. So you want to get values when they first arrive, you want to get during and in between exercises, and you want to take it afterwards, and you want to keep a log of that. You want to know what the normal values typically are, and that in pregnancy, blood pressure is typically going to decrease, and heart rate and respiratory are going to increase. Since heart rate increases, you should not use that to monitor their increase in sympathetic system. You want to monitor their RPE, which should typically range from 12 to 14, and if it exceeds that, that individual needs to be sat down and re-examined and take all the vitals again. So within response to exercise, blood pressure is going to respond. Obviously, it's going to shoot up, but you don't want more than an increase in 30 of systolic or a decrease in 15 to 20 of diastolic. If you do, you need to have that individual sit down, reassess, and take vitals again after 5 minutes. And if that is still elevated, then you need to terminate the session. If it returns to normal, then it's okay to resume the activity. If there's any instance in which the individual reaches 140 over 90 or exceeds, then you need to terminate the session and have that individual contact their medical doctor. And obviously, as I said earlier, you're constantly taking vitals, you're constantly reassessing, you're giving breaks when necessary, and if any red flags, you or the patient or both need to contact the doctor. As for exercise prescription, it honestly just depends on what their impairments are. So a lot of times you're going to see core weakness, so you can start working on transverse abdominis strengthening, right? They might not even know how to activate transverse abdominis, but you could work on that. Say they have some type of pelvic dysfunction. If it's incontinence, find out what type it is. If it's stress, if it's urge, and work through those. Kegels are a common exercise no matter what type of pelvic incontinence you have. So you can, or pelvic organ prolapse. So you can work on any of those and incorporate Kegels into their strengthening program. Let's see. Bladder retraining is another thing. Their uterus is going to become compressed. You can work on that pre and post. So there's so many different options, but basically you're trying to stabilize the lumbar region using those deep core musculature, and then you're also trying to, such as transverse abdominis, multifidus, but then you're also trying to strengthen the pelvic floor as well and increase its endurance. And then you can start, for both of them, you can start incorporating more dynamic movements. So you can, more dynamic and functional movements. You can go from a lot of static and stationary, work up the strength, and then increase endurance and allow for more functional activities, such as, the individual wants to get back to running or squatting to pick up their baby and they have incontinence. Then it's important that you really make sure that they have control and are stabilized before they perform activities such as that. So, biggest takeaways: constantly monitor blood pressure, heart rate, respiratory rate, RPE, contact a physician if anything seems abnormal, and you want to be taking it pre, during, multiple times, and post physical therapy sessions.